Hello everyone, welcome back to Doctor's Quiz. How good is your surgery knowledge? Just check it out through this video. Before that, make sure to subscribe to Doctor's Quiz for more quizzes on medical subjects. Are you ready? Let's get started. What is the name of this surgical instrument? The answer is Lane's forceps. Cyst trunk operation is done for which condition? The answer is thyroglossal cyst. Urine output less than 0.5 ml per kilogram per hour is termed as the answer is oliguria. What is this needle type called? The answer is cutting point needle. The color of 18G IV cannula is? The answer is green. Pain in right lower quadrant from flexing the right hip against resistance. This sign is known as? The answer is Soya sign. What is the name of this surgical instrument? The answer is Morris retractor. Ogilvy syndrome is also known as? The answer is acute colonic pseudo-obstruction. The most common presentation of abdominal desmoid tumor is? The answer is abdominal mass. Which type of shock develops due to blood product reaction? The answer is anaphylactic shock. A 25-year-old patient presented with neck swelling, which moves with deglutition. What is the diagnosis? The answer is thyroglossal cyst. Name the method used to move a patient without flexing the spinal column, ensuring spinal alignment and preventing further injury, especially in cases of suspected or confirmed spinal cord injuries. The answer is log roll technique. Which among the following procedure is done to assess the compartments of the skull? The answer is craniotomy. A school bus full of children met with an accident. As the doctor in charge of triage, which of the following will you attend to first? The answer is airway obstruction. Which type of shock is caused by burns? The answer is hypovolemic shock. Which Which parameter is the best guide to monitor the adequacy of fluid resuscitation in a patient? The answer is urine output. Name the surgical terminology for abdomen. The answer is lapar. One unit of fresh frozen plasma contains all coagulation factors except the answer is platelets. Which among this monitors the amount of oxygen bound to hemoglobin? The answer is oxygen saturation. Which layer of skin is involved in blister formation in a superficial partial thickness burn? The answer is papillary dermis. Which type of suturing is this? The answer is purse string. A patient presents with renal calculus of greater than 4 cm of the stag font type. What is the best management? The answer is percutaneous nephrolithotomy. A 10-year-old child came with complaints of pain over the right lower quadrant and lower back pain. On examination, the patient had pain over the right side of the hip on passive extension with a mass in the right lumbar region pointing towards the groin. What is the most probable diagnosis? The answer is psoas abscess. Strawberry gallbladder is also known as the answer is cholesterosis. A trauma patient suffers a renal laceration with urine extravasation. He is managed conservatively. However, after a few days, he presents with a urinoma. The next best management for this patient would be the answer is urethral stenting. If you are interested to learn medical subjects through quizzes, then do subscribe to Doctor's Quiz. See you all soon in the next video. Until then, bye bye. Take care.